someday.
Well, welcome. We're continuing our series of getting to know our new faculty, and we're really thrilled to have Dr. Anai Kothari here with us today. And Anai, would love to have you tell us a little bit about yourself. It's unusual that we have someone born and bred in Wisconsin on our faculty, so we're just so excited about this. But tell us about Manitowoc, right?
That's right.
About Manitowoc, and then how you ended up here on our faculty.
Yeah.
Maybe start with Manitowoc.
Yeah, so I grew up in Manitowoc, which it's an amazing city, and you don't really appreciate it until you leave there and you think about, like, I grew up on on the lake, you know, in northeast Wisconsin, and just really some of the most incredible people. And you know, my dad was the manager of the public utility there, so we were really engaged in the community, and it really has informed kind of how I grew up and really who I've become over time. So I grew up in Manitowoc, did my undergrad and medical school at the University of Wisconsin in Madison. And then every attempt at leaving the Midwest has failed. So I went to Chicago for residency at Loyola. And then I did take this, as you know, a little brief time away in Houston for my surgical oncology fellowship. But it was really impossible not to find my way back.
Yeah. I know now you wish you did your residency here, but but what kind of brought you to Loyola? Why did you pick Loyola for your residency?
So the chair at the time at Loyola was Paul Koo, and he's become one of my most incredible mentors and sponsors.
Sure.
I remember sitting down with him much like this when we first talked about what the program was going to look like, and it was incredible how much it aligned with what I was hoping to eventually achieve in my career, which was to be an academician, be at a place where really, you know, the opportunities were there, just you had to seize them. And then it was this chance to really treat a wide, you know, patient population with many complex issues, and I thought, coming out of a residency like that would be you know, would prepare me for it.
And maybe one step backwards. In med school, why did you pick surgery as opposed to all the other aspects of medicine?
It's funny. This is actually really it's a good story because it has an MCW tie, and I rediscovered this. Actually, yesterday I ran into Dave Milliot in the hall.
Yeah.
So Dave was a resident at Lehigh Valley out in Pennsylvania, and don't worry, it's a good story, but it may take some time to.
That's okay. We have time.
The breadcrumbs.
Don't turn us off, Haley.
So Dave, as a resident, one of his faculty was actually my uncle. And when I was an undergrad in college, between my first and second year, I actually went out and did an observership with my uncle out in Pennsylvania. My uncle's practice was trauma and pretty broad-based general surgery. And the first time I ever watched anyone do anything in the operating room was Dave Milliot.
Oh, wow.
Yeah.
Oh, wow.
So when I went to medical school, I had this idea that surgery was going to be something I was interested in, and I tried to resist it. My uncle loved what he did, but really tried to warn me away from it. And so I tried to be undifferentiated through medical school, and I actually did surgery last. It was my last rotation, and just being in the OR environment is what hooked me, and it continues to. It's the team, you know, working together towards a common aim. Many of the same reasons that I got interested in cancer, same kind of concepts.
Absolutely.
Mission-focused, and everyone is mission-focused on the same thing.
Yeah. And how'd you like Houston? Did you get to like chicken fried steak or margaritas with salt or anything else?
Yeah, it's nice and hot down there. You know, I miss the queso and the Tex-Mex quite a bit.
Yeah.
As you know, MD Anderson's an incredible place to train. And that idea, I'd never been at a cancer center like that. And when you talk about all the people there, when it comes to treating cancer, it's this singular focus on let's make people better from what is a terrible diagnosis.
Yeah.
And then just the ability to really learn and hone the craft of surgical oncology is really important.
Sure. Well, the Cancer Center at Loyola became famous, at least in my world, when Cardinal Bernardine, who was one of really the first famous people to get pancreas cancer, along with Michael Landon from Little House on the Prairie, and then subsequently Patrick Swayze. But Cardinal Bernardine was operated on at Loyola, which really was brought at least their solid tumor oncology program a couple generations forward. Really, it was such a big impact for them.
And Dr. Arana, right?
Exactly, Jerry Arana, just a wonderful man, wonderful surgeon, and it really certainly launched his career and for someone who had a lifelong interest in the disease. But really, so many side stories. You can see Anai and I could talk about this forever. So, so we're thrilled to have you here at MCW. Needless to say, tell us about where you would like to be in 5 or 10 years in the field of surgical oncology, the impact that you would like to make, and some of your interests in medicine.
kind of think about it in two ways. One is clinically and where to make the impact, and the other is from a research and academic standpoint. Clinically, what I treat most commonly is people with stage 4 cancers surgically, whether it's peritoneal-based or to solid organs like the liver. And that patient population is one that oftentimes gets turned away.
Sure.
The options end up being limited in terms of what we can potentially offer. But really what surgery has done as part of multidisciplinary care is changed the paradigm for thinking about how we can effectively treat, not just from a palliative standpoint, but even potentially to cure
Sure.
disease sites. And so if I look ahead, really it's to essentially be able to really deliver high quality care to that patient population. And then from a research standpoint, the movie Moneyball. And it's how do we Moneyball
one of my
surgery,
favorite movies.
How do we really take all of this data that we have, that we collect on a routine basis, and activate it to really change how we treat patients? And so those are kind of the two areas of focus for me.
Yeah, and for those people who may not be familiar, I mean, I've learned so much from talking to you about big data, and you can use the term, but it's one of those things where many of us who are not in that space don't really understand what that is. Maybe you could give perhaps a couple examples, even if you wanted to give the CA19-9 example, for example. I think that would be great. But to bring it from the abstract for many of the, especially a lot of the people who will view this video, are surgical either surgical residents thinking about doing their Surg-Onc fellowship here, or medical students who are thinking about doing their residency here. And I know when they see this video with you, they're going to be inspired to do that. But
well, I think the best way to lay it out is just kind of how you conduct the course of your day. You wake up, and there's an alarm clock, but sometimes the time that it goes off is based on when you wake up. Or you get in the car and it gives you the driving directions to where you're going to go, how long it's going to take to get there. You arrive at a place and the temperature changes based on kind of your routine habits. And all of this comes from the data that you generate all the time, sometimes unconsciously. I have a funny story about we were talking about immersion blenders in a very abstract way in my house, and the next day I had an advertisement for an immersion blender on my web browser. And
wow.
It's these things that are getting collected all the time, and you can take that to clinical medicine, right? We're collecting data all the time on our patients, whether it's entry into the AHR, now genomics, et cetera. And what other companies and industries have been able to figure out how to do is how do you actually make that usable? How do we figure out what time you're going to wake up? How are you going to? And those things help us. They're a little scary, but they do help us ultimately. They've made our lives better. In many ways. And similarly in medicine, it's the same idea. How can we take all that data that we generate and use it in ways to improve patient care?
Sure. Yeah, so important. Last question. What do you like to do outside of work?
We traveling was our go-to thing to do. So we're trying to get back to it post-pandemic, or I shouldn't say post-pandemic, peri-pandemic. But it's getting out, seeing the world, and we have a 3-year-old, so it's fun to show him.
Oh, that's neat. And you know how to get to Manitowoc from here? Yeah. Great.
You'll have to take us up there on the boat.
There you go. Right? We'll do it. We'll do it. Dr. Anai Kothari, thank you so much. Really great to talk with you, and thanks for doing this video.
Thanks.